Today, we're talking about screening moms for perinatal mood and anxiety disorders or postpartum depression. Welcome to our channel where we give tips for surviving motherhood and provide a place for honest conversations about women's mental health. We make new videos every Monday, every week. We hope you like our video and don't forget to subscribe below. Dina, can you tell us a little bit about who is able to screen moms?
Absolutely. Screening is so very important. And really anyone who comes into contact with a mom, either during pregnancy or postpartum, can screen. And so this includes birth workers, doulas, midwives, nurses, OBs, doctors, lactation consultants, childbirth educators, home visitors, WIC program workers, hospitals, really anyone who is advocating for mom's mental health can screen.
Yeah, it's just important that screening takes place. It's not limited to mental health practitioners or counselors. It's also important to note that screening helps identify our symptoms so that one can be referred to a mental health practitioner. It doesn't provide a diagnosis. And there are two screening tools that I really like using with moms. The PASS helps identify anxiety, and then the Edinburgh helps identify symptoms of depression. Oftentimes we only see one of these being completed, which is the Edinburgh, but I think it's really important that we utilize the PASS as well. That way we're not overlooking the anxiety components. So let me tell you a little bit about each one. The Edinburgh Postnatal Depression Scale takes into account how one has been feeling the last 7 days. Moms self-rate themselves, indicating a frequency of symptoms. And a total score of 10 or more indicates possible depression. The screener should pay special attention to number 10 because it asks about thoughts of suicide. And then the perinatal anxiety screening scale is self-rated for all 31 questions, indicating the frequency of symptoms over the past month. The items are on a scale ranging from 0, which is not at all, to 3, which is almost fully. The total PASS score is obtained by adding all of the items on the PASS. And the cutoff score that we're looking for on the PASS is potential perinatal anxiety is 26. So Bina, do you want to share a little bit about when one should screen moms?
Absolutely. And I think what you said is so important, that with a screening tool, the reason that anyone can be trained in how to screen is that, and it really is just that, it's a screening to look at, does this mom need to be referred for a full assessment? So it is really good for all of you out there that work with moms in any capacity to watch this video and get training on how to do that screening. So in terms of when to do the screening and how often, Postpartum Support International has some set guidelines on when it is good to do those screenings. So it should be done at the very first prenatal visit, at least once during the 2nd trimester, at least once during the 3rd trimester, at the 6-week postpartum OB visit or the first postpartum visit whenever that occurs, and screening again at the 6-month and or 12-month visit in the OB or primary care settings. And also screening is recommended at the 3-month, 9-month, and 12-month pediatric visit. So that would be done by the pediatrician. And so it really is a team effort to help moms be adequately screened for perinatal mood and anxiety disorder. And the reason we screen so often is because it can occur any time during that first year postpartum, and we don't want anyone to fall through the cracks or be suffering unnecessarily. And so Felicia, when we talk about screening and the screening tools, what should we be saying when we're giving these screening tools to moms?
Yeah, screening is great in helping determine if a mom may be struggling with the perinatal mood anxiety disorder, but it's also important to just not forget the simple basics of having conversation with her and asking her how she's feeling. Ask her how you're being supported at home and in your community. Are you having more bad days than good days? Do you have a fear of being alone with your baby? Are you able to sleep when the baby sleeps? Are you having thoughts that are scaring you? These can help one recognize that something bigger may be going on, and referral for a specialist in maternal mental health may be appropriate.
Absolutely. And I think that is so important with the screening, that it's not just giving them a piece of paper to check off the boxes, but letting them know this is something we ask everybody and we're here to support you. And then also having the tools and resources of knowing where to send them for the further assessment if needed. So that's all we have for today. So please comment below and tell us your experiences with being screened. And today we discussed screening for postpartum depression and anxiety. Thank you for watching. If you or someone you know is struggling with a perinatal mood and anxiety disorder, please reach out to the Postpartum Support International warm line listed in the number below. Don't forget to subscribe to our channel for more videos about surviving motherhood. Bye.
Bye.